Like, where does the body process pain? And how is that different, or how is that affected in the situation of anesthesia? Well, it turns out most of our pain reflexes are so primal, it's like the first reflexes we learn to have, that they are actually processed in a very quote unquote lower center of the brain stem. It's kind of like near the back of your neck almost. That's where a lot of your basic body functions are processed. So your heartbeats and your breathing and things like that. And that's where pain reflexes are too. And it turns out that even when someone is under anesthesia, that part of the brain is not completely disrupted. So that is, you have your basic reflexes intact. So your body is able to process pain. However, the drugs that we give kind of counteract that. So the drugs that we give bind to the pain centers in the brainstem and try and prevent kind of that information from coming in. So it's a little bit of a tug of war that's happening between the drugs that they're giving and then what the surgeons are doing when they're cutting into you and, burning tissue and doing all this stuff, right? So it's a little bit of a tug of war, and whoever wins, you're going to either see a lot of pain being processed there, or you're not going to see very much pain being processed there. And that can change also over the course of the surgery, right? Because the drugs will wear off at different rates and things like that. So that's the underlying physiological principle. And then from that, we have to be, sit down and think about, well, how do we capture that fight or flight response, right? Because that is